First in the Nation program kicked off in Washington today. The state began offering benefits through the KREM Fund, designed to help with the cost of long-term care.
It comes at a time when the need is certainly growing. Nearly 500,000 Washingtonians are expected to need long-term care in the next decade. KREM 2's Christian Garza looks at whether this new benefit can help meet that growing need. Christian.
Mark, Sydney, most people don't think about long-term care until they or a loved one need it. And by then, the cost can come as a shock. Now, Washington is hoping a first-of-its-kind program can help ease some of that financial burden.
And now we're excited to inform our patients and our community members about this program as it begins to deliver for Washingtonians.
The Washington State Department of Social and Health Services says for the last 3 years, Washingtonians have been paying 58 cents for every $100 earned into a statewide trust fund, unless they chose to opt out. Today is the first day eligible Washingtonians can start using the benefits they've been paying into. Once you become eligible by paying into the fund for at least 10 years and meet accessibility requirements, you can access the program's benefit amount, which is currently $36,500. If you haven't paid into the fund for 10 years but need help with long-term care, there is a reduced amount available based on how many years prior you were able to contribute, and there is even a retiree track for those born before 1968 who might not be working for the next decade, meaning you get 10% of the benefit for every 500 hours you work annually. B. Rector, the Assistant Secretary for DSHS, said in a recent press conference the program itself is meant to give Washingtonians more options.
We partnered to build a program that we believe will bring Washingtonians greater choice, greater peace of mind when it comes to the need to navigate getting help for themselves or for a loved one.
Both Washingtonians who need the assistance and the close to 800,000 caregivers who are providing $1.2 billion worth of care to family members, like Christina Keys, who has been taking care of both her mother and partner.
And so this is where things like WACARES can come into play. When that happens emotionally with us, we are not thinking clearly, so that $36,000 gives us a point where we can take a breath and figure out what we need to do next. So I'm very grateful that it's going to be there for me and for others like myself in the future.
Now, what happens if you've paid for the fund but need to move out of state? DSHS says if you leave Washington, you can elect to keep contributing into the fund and have at least a year to decide what you want to do after moving. DSHS says they are working to allow those benefits to be used outside of the state in 2030. Now, if you want to see just how much of the fund you are eligible for at this point, you can request a program statement from the WACARES Fund website. In the newsroom, Christian Garza, KREM 2 News.